Looks like Dr. Kishore has joined the call. We'll just wait for 2 minutes to see if anybody else wants to join the call, and then we'll continue. Is that okay, Dr. Kishore? I can't hear you. Mute. You are on mute, Doctor.
Hello.
Yeah. Can we can hear you now? Yes. So
Yeah,
we'll give two or 3 minutes more for anybody who else want to join the call, and then we'll continue. Will that be?
sure, sure. Sure, Sri Krishna. No problem.
Thank you.
Okay, let's start the session. Okay, hello everyone and welcome to today's session. I'm Lavanya, founder and director of Neldrac, one of the leading providers of early learning crash and daycare centers. The agenda for today's webinar is raising concerns and awareness towards COVID-19, vaccinations, and suggestions on safe school operations at Neldrac. I'd like to introduce our guest speaker, Dr. Kishore Jayanti, MBBS, DCH, Fellowship in Pediatric and Cardiac Intensive Care, Fellowship in Heart Failure and Mechanical Support for Children and Adults, Consultant Pediatrician, Pediatric Cardiac Intensivist, and ECMO Specialist at Star Hospitals, Hyderabad. Now, without further ado, we'll turn the time over to Dr. Kishore. Hello, Dr. Kishore.
Hi.
How are you?
Hello, everyone. I hope everyone is doing well and having a good weekend.
Yeah, well, we'll
I'm good,
hope
thank you.
everybody is doing safe. And can we start with our questions, Dr. Kishore?
Yeah, sure.
Okay. What is the current COVID scenario?
Yeah, as everyone knows, the current COVID scenario is very evident, and we are still yet to reach the peak. I think it will probably be in the end of the April or in the early or mid May. We might reach the peak. According to the projections and the predictions, most likely it will be like the daily active cases will reach around 20 million and then start coming down from mid May or something like that. So it's always better to be careful, and until then, maybe next 2 months we need to be very cautious.
Okay. So, what would you suggest with the vaccination, co-vaccine and Covishield? Can you give us any information on those vaccines, please?
Yeah. So at the moment we have two brands, Covishield and Covaxin. Both are produced in India. Covaxin is produced by Bharat Biotech, and Covishield is produced by Serum Institute of Pune. But the original molecule is from the United Kingdom. So both are good. But when I talk about the efficacy, uh, it's mentioned that Covishield has an efficacy of 65 to 70%, and Covaxin has around 80% efficacy. The How I can explain this is basically, if every 100 people get this particular vaccine, that Covishield, out of 100, only 70 get protection, and the rest 30 do not get protection. So that is what is meant by the 70% efficacy. And the government has uh, prolonged the second dose duration by 6 to 8 weeks, so that the best efficacy is achieved. I mean, Lancet Journal has mentioned recently that if we increase the gap between the first and the second dose and to 6 to 8 weeks, I think the antibody generation will be better than just taking it 4 weeks or roughly around 1 month. So now I think we can follow that, and so that we can get a better protection with that particular vaccine. So Covishield also, it's mentioned as 65 to 70%, but the efficacy will increase to 80% if we follow that particular norm. The Covaxin is mentioned as it's mentioned that Covaxin efficacy is around 80%, but the phase 3 trials are not yet finished. So until those results are released, we can't really confidently say that it is 80% effective. It's just arbitrary number, just an arbitrary number. So as of now, I think whatever we get, we need to take rather than waiting for a particular brand or something.
Okay. So here I have a small doubt. With the Covaxin and Covishield, does do we need to specify it like the above 60 has to take Covishield, Covaxin, and below that can go to separate this vaccine? Is there any age difference, with the vaccine, or anybody can actually take
Uh,
both the vaccines?
So until recently, I think there was no specific age limit. But now, after the you must be aware of these kind of side effects, like some clots are developing in
Yes.
some patients' blood vessels, and that has been more evident in the European countries. Not much in India, but maybe it's more related to genetic predisposition or something like that. But whatever, it's more noticed in the younger ones and younger females. So people who are below 50, I think the European governments are advising them to take other brands like Pfizer or Moderna or something, and then older population, they are still recommending this Covishield itself. You can go ahead with the but in India we haven't really seen so much of so many side effects or anything like that. So most of the population who took this vaccine only had some minor side effects like fever, body pains, and headache, or some uneasiness for 24 to 48 hours, and later they were completely fine. So according to my experience here in Hyderabad, also I've seen a lot of my colleagues and other patients. Most of them are not infected. Even a few were infected, but their symptoms were mild. Even after the second dose, they were infected, but they had very mild symptoms. At least what I can say is, it may not prevent you from reinfection, but your hospitalization and the requirement of oxygen and the ventilation and all these kind of things will be curtailed. You can reduce the severity of the disease. So whatever you get, you just take it, because now we have acute shortage of the vaccine. So we should not. It's not wise to wait for a particular brand.
Right. Thank you, in that. Also, now only above 45 years old are supposed to get the vaccine. But say if the government is giving the permission to reopen schools, what about the children below 6 years, the 6 months to 6 years old? Are they getting any kind of vaccine in future? You have any idea on that?
No, I don't think anywhere in the world it is recommended as of now. Only some trials are being done in the United States and some countries. That too with the Pfizer vaccine.
Okay.
That's not available in India, of course, as of now. We have only two brands, and the Sputnik vaccine is now, I think, being approved for emergency purposes. It's not yet finalized, I think. So as of now, nothing for children. We might get it, but right now not.
So because the children don't have any vaccines at this stage, so
Yeah.
let's discuss
we're
about what.
not uh, we're not seeing uh, very severe disease in children. In the first wave, children had very mild symptoms, or most of them were asymptomatic. And in the second wave, a few are getting some low to moderate grade fevers and some kind of diarrhea, loose motions, and all those things. But they're they are getting admitted also, but they're not becoming too sick.
Okay.
The only thing, the difference between adults and children is, adults get disease within a week of the entry of the virus into the body, but children do not get that. Suppose in adults, if the virus enters, suppose I take my example, if the virus enters my body, I may get symptoms within the next 10 days or 14 days. But what is happening with children is, some children who are becoming sick, they are getting symptoms after 2 months. Suppose the virus enters a child's body today, the
Okay.
symptoms appear only after 2 months. By that time, antibodies already developed. The peculiarity is, in adults, virus is causing the problem, but in children, the antibodies are causing the problem. So that is a little bit of dysregulated response by the body. The antibodies are sometimes inadequate and they are causing some trouble, but there's still a lot of treatment for that. And I don't think many children have suffered, and they have come out of the hospitals very quickly as compared to adults.
Okay. So, as I was saying, because we don't have the vaccine, maybe we'll discuss on what are the safety precautionary measures we have to take initially first at home, what are we supposed to do?
Safety measures is, as everyone knows, it's a social distancing and wearing masks. And the recent studies have shown that wearing two masks is more protective than wearing a single mask. And wearing cloth masks in heavy crowd is also not a great, not advisable to wear cloth masks in the crowd. Maybe it's okay for kind of some uh, environment where there's less population or crowd, but if when there is too much crowd around us, it doesn't help. It's better to wear an N95 mask or maybe surgical mask. That's ideal base, or maybe in fact two masks are better than one mask.
Okay, like cotton mask and then cover it with a surgical mask or something on the top.
Yeah, that's better rather than one mask. I think two masks are ideal if we can. I know it causes suffocation. It can also cause carbon dioxide retention. It's
Yeah,
not good for people who have lung disease and asthmatics and all those. But we should be, intelligent enough to deal with this. So we need to remove the mask, or give a break when people are not around and we are in ventilated space, or when we are in our balconies or something like that. So when we are around people, we should wear it. So just try to give a break when it is really not required.
yeah. So now is there,
It's yeah,
there's a rule that you have to wear a mask even inside the car. So
yeah.
how much do you suggest on that? As you were talking about ventilation within the small space inside the car.
If you are using your car and no one else is using,
Hmm.
so I wouldn't advise you wearing a mask, and I would just advise you to just, uh, get down the windows a little bit,
Yeah.
so the air keeps circulating through the car and then gets out of it. So it gets the virus gets diluted even if something is there inside. So I don't think it's a wise thing to wear mask with in the car. So if you have your friends or someone,
Traveling with.
not family members, or you're not someone is going out and coming back repeatedly and they are traveling along with you, then maybe.
Okay.
But otherwise, even then also, if you keep your doors open, you don't require a mask
Yeah. So all right.
because
So
there's a lot of air circulation going into the car and coming out of it if you keep your doors open.
yeah.
Yeah.
Okay. Can you tell us what type of cleaning materials should we use at home, to avoid any COVID germs or whatever we call it?
You mean cleaning materials at home or at school or
At home.
offices or
We are
at
first
home?
discussing at home.
At home, you have regular things like choline spray, then you have ethanol spray, you have Savlon spray. These kind of things you can use, but the only danger is the children can have accidental ingestion and poisoning and all with that. So the best thing is you once they sleep in the night time, you can just spray it on your regular surfaces like your tables, windows, and the things which are usually handled by children regularly. Those kind of things you can do and nicely clean with a clean cloth. That's that too after the children sleep, so that you have 12 hours or more than that for it to get dry up, and then you can allow them to use those materials later in the morning. But it's better not to do it in the morning time.
Okay.
uh, yeah, it's not safe actually.
So do you recommend to
And
sanitize
it's always advisable to keep them in a out of reach,
safe?
and then in separate locker or something.
Yeah. Yeah.
Yeah.
So can we frequently fumigate the house or sanitize the house, or how frequently can we do it?
No, fumigation involves chemicals like formaldehyde, glutaraldehyde, all these things. So it's not advisable. It's banned nowadays. Fumigation is out of question because that is carcinogenic. It can lead to cancers if you inhale that fume. So it's not advisable. So you can just do some deep cleaning if you want, but as I said, after the children sleep, you can do it. And it's not mandatory to clean daily also, because if you are there most of the times at home, there's no point in cleaning. If you're just going out and coming back and getting some grocery and something else, you keep it in a separate area and leave it for a few hours so that no one reaches there, and then later you can use it. But the rest of the things uh, don't need repeated cleaning,
Okay.
at least at home. Maybe in offices and other places it's okay, but at home it's not required.
So we don't need to wear mask or anything at home because
No.
uh,
Only you have to keep your doors and windows open and let the air circulate well in, keep the house well ventilated. That is more important. And keep some distance, even at home you just keep some distance like 2 to 3 meters between. I know it's difficult, but whenever possible.
yeah, yeah. Like maybe when we come from outside, we just you know
Yeah.
clean up properly and then meet the other family members.
Yeah.
Okay. So the next thing
Yeah,
is
I have dealt with sorry to interrupt.
no, no, please go ahead.
I have been dealing with these COVID patients, both children and adults, since last 1 year. I'm still not infected till now. I have not, and most of my colleagues were not infected. So if you really follow all the precautions well, you will not get infected. The problem I have seen is most of the people wear masks like this and then speak when they, when they want to speak, they just put it down and their nose is completely exposed. That should not be the case. It should be tight enough. There is a nice, kind of strip given on the surgical masks and the N95 masks. You have to tighten that here,
Yeah,
and so that you will also get enough space inside to breathe. It's like a bit conical like this, so you have inside some space to breathe, and there is a bridge there. You tighten that bridge and make it like a nice closed space. You can easily breathe.
yeah. So that exactly that was my question, like how to exactly properly wear the mask. And
Yeah.
two masks should be worn. So when we are wearing double mask, one is can we wear both N95 or how? Too much.
No, if it's N95, one is enough.
Okay,
If it's some other masks, it's always better to use two. Like if you use a cloth mask, put a surgical mask on top of it.
okay,
If N95, there is the definition of N95 is N95 means it inhibits the virus by 95%. That means there is a 95% chance that the virus will not enter. There is still a 5% chance, but 95% it will not. But the cloth masks and all, they only prevent by 40 to 50%.
okay.
And that too, cloth masks, there is no tightness around the
Yes, yes.
mouth and
That's
nose. It's
that's
just a loose mask,
yeah.
so there is a chance that it enters from somewhere else.
Okay. All right. Okay. Thanks on that. So I had few questions now whether how to follow the precautionary methods in our school or any preschool. So,
Okay.
do you have any idea when would be a right time for the institutions to resume back? Do you think?
See, when I think based on the scenario, I think the government will decide, following advice from the specialists, the doctors, and the microbiologists and all the other people, public health specialists. All these people would advise the government. Based on that, they will tell you when to open. But once you get the permission, and then we have to go ahead and start it with some safety norms. That's it.
Okay. So earlier when you said that we cannot fumigate the house, can we fumigate or do the fogging in the school premises? Because again, it's the same children who come in, and how safe is it for them?
You mean the school premises?
Yeah, the organized.
Even school also, no fumigation in school also. Even in hospitals, we stopped it actually. So no fumigation anywhere. It's just deep cleaning, only deep cleaning. So you can use something like more stronger solution like Bacillol spray.
Okay,
Bacillol spray is a spray where you have these all glutaraldehyde, all these things solutions where You can just spray on your tables, windows, all the surfaces nicely. Again, in the evening time, after all the children go home, you can do that, and then leave it like that. By the time when the children come back in the morning, everything will be perfect then.
Yeah, like a
So
everyday deep cleaning has to be done.
you can do it every day. Yeah, you can do it every day, and then leave your windows open. Then it'll be fine.
Okay. So what
And
are
nowadays it's nowadays it's the literature has come up more a strong literature has come up, and they are against all these things more frequently. You can do it on and off, but not repeatedly, because this can cause harm to your skin and so many other things. Allergic disorders can occur with all these things. So um, what they're saying is the infection is more from person to person via the respiratory tract rather than surface contamination.
right? So like,
Yeah.
what are the safety norms that we need to follow, in a workplace or in a school or anywhere?
In a workplace, the safety norms would be before starting anything, we have to vaccinate all the staff.
Okay.
And of course, even if someone has any problem like flu or some other symptoms like loose stools or body pains with fever, tiredness, exhaustion, and maybe loss of smell and taste, these kind of things which are prominent and suspicious of COVID, then uh, they have to stay back at home. The children or their parents, if they have it, then they should not send children to the institution. Or even if it's whether it's a school or some other institution, it's the same thing. It's the same norm for everyone. They should not have vaccination as the primary thing.
Yeah.
Then isolating people whenever there is some suspicion. Then the third thing is ventilation,
Okay. Hmm.
preventing overcrowding.
Yeah. Maintaining the distance.
So, and some regular cleaning. Maybe soap water is good enough. Soap and water is good enough, but in particular instances, we need to use the hand rub.
Yeah. Like,
Yeah.
how much sanitizer has to be used? Because, as you said, a lot of allergies and younger children's skin is so delicate. What would you suggest? How much, what's the amount of sanitizer, or in a day, how many times can you actually sanitize your hand?
See, as I said, it depends on the place. If it's at home, absolutely not required.
Hmm.
Then, if it's at school or some other place, uh, if you are touching, if they are sharing the things and handling repeatedly, then maybe occasional hand rubs is okay. But again, you have some other things like you can use the COVID keys. You have some separate keys available on the Amazon and some other places where you can open the doors with those kind of things. You can give, those kind of things to the staff, and
Yes.
so they don't touch the thing directly. Yeah, those kind of things. So they don't touch the knobs directly. They can use all these kind of things. And then in that case, if you take maximum precautions, and you don't need them to sanitize their hands repeatedly. The children, I think it's better to avoid
Okay. So
sanitizing hands.
also when you're using
Then
sanitizer,
the other thing is, one more thing is, if you wear glove,
yeah,
yeah, it's not, you can't, we can't assume that it's safe, because after wearing glove also we keep touching all the surfaces.
yes,
Again, with that, if you touch the nostrils and everything, then that will lead to contamination and infection. So we need to still clean our hands despite wearing gloves.
okay. Like when we're talking about sanitizers in the market, there are so many types. There are liquid based, there are gel based, there's the thin and thick. So what is the exact,
Sorry, I can't hear you.
in the market? I see that there are different
I
types of.
can't hear you, Lavanya. I can't hear you.
Can you hear me now?
Yeah, yes, yes, yes.
So I was asking, the in the market there are so many types of sanitizers available. liquid
Mhm.
based and gel based. There's so many varieties. What do you think is the best one, that we could be using?
So it's always better to go for liquids,
Okay,
and it should contain 70% alcohol.
right.
That is the best solution for hand drugs. So it's isopropyl alcohol
Hmm.
or ethanol, 70% should the minimum concentration should be 70%. Otherwise, it's not effective.
70%. Okay.
There are lots of solutions with lots of attractive things in the solution, and all that doesn't matter for us. The most important is you just see the composition. If it's 70%, you can take it. Otherwise, just ignore it.
There's one more question I would like to ask. Do the kids need to get the flu shot for the season to avoid
Do kids get?
the
Do kids get?
flu shot?
Uh-huh.
Usually they take the flu shot, right? Do you suggest to take that just as a safety precautionary method?
You mean the regular flu shots?
Regular flu shot, yeah.
Yeah, yeah, that can be taken. That's not a problem. That may or may not prevent COVID. We have no idea about it because I don't think that prevents COVID. But regular flu shots they can take,
Okay,
and when they take the flu shots, they should not have active infection like loose motions or fever or severe cold cough. It's a mild stuffiness is okay, but they should not have active infection.
okay. So, are they giving the same kind of medication to children below 6 years or 10 years, below 10 years, if they have contacted COVID-19, if they have been positive? Is it the
Okay.
same medicine?
For smaller babies like infants and children below 5 6 years, the only thing you can use is azithromycin
Okay, antibiotic.
and paracetamol. Azithromycin, paracetamol. Rest of the things like zinc, vitamin C, all those things you can give.
Okay,
But uh, in adults, there are different medicines like ivermectin, doxycycline. There are some anti-gout medicines, antacids, all these things they're administering for COVID also, but that is not advised in children. In adolescents, which who are like 16 years to 18 years and all, then maybe we can use half the dose of what is being prescribed in adults. But younger kids, nothing. Only azithromycin maximum.
okay.
As
So,
I said, that the virus, the harm caused by virus in children is very little.
yeah,
The harm is more from their own antibodies, which are generated after 1.5 to 2 months. And that too, if the antibodies in their blood are inadequate. So that's a different mechanism completely. I don't think I can explain because it's very complicated.
yeah, right.
So yeah, so that will present in a different form like rash. Suppose you assume that some family member has got uh, COVID today, but the child is completely free of symptoms, and the child has some symptom after 2 months. The symptoms can be like rash on the skin, like a kind of breathlessness, or um, something like that. Okay, then fever, even fever, high grade fever, these kind of things after 2 months. If the child has, then you can suspect, oh, maybe I had 2 months ago some infection. My child has some kind of symptoms now. Maybe it's related to that. Then you can once go to the doctor and get screened. Then they will evaluate and let you know.
So, see, as a pediatrician, can you give us any tips on how to explain the children about, to stay safe during COVID?
Safe,
How to, stay safe during COVID? How do we explain them?
stay
That this,
safe.
yeah,
Uh, During, I think, peak COVID, the best thing is to retain them at their home.
mm,
That's the safest thing to be done. And then once the infection comes down significantly, they can play along with other children, and that should not make a difference. But when the situation is like this, I think the best thing would be to stay at home.
yeah. one last question, Doctor. With the second wave, we hear we get to know a lot of children are also being affected with
Yes.
COVID. Is there any long-term side effects, mentally or physically, if for the children who have been COVID positive?
It's a tough question because it's only 1 year since we are facing this COVID. We haven't have much experience about this. It's 1 year is too short to say to tell this, but I think the children who were infected in 2020, early 2020, and who came out of that, they are doing well as of now. They are not having any issues. In adults, usually they have, some of them have a lot of fatigue for 3 to 6 months, almost 3 months, 4 months also. They have loss of hair and fatigue and exhaustion, they can't work properly, all these things. But children have a lot of resilience, they can easily tackle this, I think, compared to adults.
So, well,
From the experience and literature till now, there were not many long term effects, but we still have to wait and see.
yeah. Well, all we can do is we'll just hope that everything settles as soon as possible and
Good.
everybody get back to normal. And that was a wonderful information, and it indeed helped us answer our queries. Myself, as a parent and a responsible citizen and a center head, have learned so much today about the safety and precautionary measures that we need to
Okay.
follow to keep ourselves and our loved ones safe during the COVID time. Thank you, Dr. Kishore. I can't thank you enough for your valuable time.
Welcome. That's it's good to be with everyone and sharing my knowledge with everyone. Thank you. Have a good day.
Thank you. And on behalf of Neldrac, we also would extend our sincere thanks to all our participants for taking time out and being here today. We would love to hear you, and I request you to shoot out any queries to us, so we will have an opportunity to get connected back to the doctor in answering them. Okay, and a recorded version of this webinar will be available on our Neldrac's Facebook page, on our YouTube channel, and LinkedIn. So thanks once again, everybody, for joining us, and we'll see you next time. Stay safe. Thank you.
Thank you.